Good afternoon, all. Today I'm going to present my report on retinopathy of prematurity in small for gestational age versus appropriate size for gestational age premature infants, which was a prospective study. There were no financial disclosures. So coming to the introduction, as we all know, retinopathy of prematurity is a proliferative fibrovascular disorder affecting the peripheral retinal vasculature in premature infants of low birth weight and young gestational age. So with improved survival of sick premature and very low birth weight babies and with good neonatal care, there has been a steady increase in incidence of retinopathy of prematurity. So emergence of ROP depends on interaction of multiple factors which we all know, such as gestational age, low birth weight, hypoxia, duration of oxygen supplementation, and all others. So a small size for gestational age is a very less studied risk factor. So we designed a study to compare size of gestational age with incidence and severity of ROP in premature infants. So this come to our aim to compare the incidence of ROP in small for gestational age with appropriate size for gestational age infants in central India. So coming to material methods, it is a prospective comparative observational study conducted in GMC Bhopal. So ethical clearance was taken from Institutional Ethics Board. This study was conducted for 18 months and all the premature infants with gestational age of less than 37 weeks and weight less than 90th centile were included in this study. Data was collected in preformed pro forma and entered into MX Excel sheet and analyzed accordingly. So coming to the result, as we can see, we have seen 16% of the appropriate size for gestational age infants having ROP compared to SGA, which was 18.4%. So as we can see here, so the p-value is only significant in 29 to 31st week of infants in SGA and AGA. In other gestational age, above 32 weeks, it is non-significant, and below 29 weeks, it was also non-significant. So as we can see, distribution of severity of ROP, it was also non-significant in AGA and SGA infants. Severity, it was also came non-significant in AGA and SGA infants. So coming to the discussion, so in our study, we have total 603 neonates which met inclusion criteria, and these were included in our study. So in our study, 353 infants were AGA and 250 were small for gestational age. So this study shows SGA infants with gestational age of 29 to 31 weeks were more prone to develop ROP than their AGA peers. We are not able to find any significant difference below 29 weeks of gestation, supposedly because there were no low numbers of the patient below 29 weeks. So there were similar studies such as C.A. Dhaliwal et al. In 2008. He also found that SGA infants born at gestational age of less than 32 weeks are more likely to develop ROP, but they also haven't got any severity more in SGA infants than AGA infants. So Lundgren et al. In 2014, in their study concluded that SGA infants for gestational age between 26 to 32 weeks are at higher risk of developing ROP. Similar study was Thokre et al. In their study, they found that ROP incidence was higher in SGA infants compared to AGA infants. They haven't mentioned the weeks. So Carrot et al. Have also observed SGA as a significant risk factor for development of ROP. So a systemic review, there was a systemic review which concluded that the SGA is an important risk factor for development of ROP at any age of ROP as well as ROP needing treatment. So to conclude, small for gestational age premature infants at gestational age 29 to 31 weeks are more likely to develop ROP than their corresponding AGA peers. And SGA infants of birth weight less than 1000 gram were at higher risk of developing ROP than AGA infants. No significant difference was found in any other weight groups. No significant difference for severity of ROP was also noted. These are my references. Thank you.
AGA you have written?
Ma'am, small size for gestational age and appropriate size for gestational age. This was based upon the growth charts which are mentioned in UPGAR score also. So,
So
from
they have that scoring system for that. How do they classify it as this?
yes, ma'am.
So who had helped you, the neonatologist, to
And
classify this?
there are charts. There are charts available. So we can divide based upon the charts, which was SGA, SGA. These were percentile charts. So 10th, less than 10th percentile infants are small for gestational age. 10th to 90th percentile infants are appropriate size for gestational age, and more than 90th percentile are known as larger size for gestational age.
Okay, so if there are twins who are of the same gestational age with different birth weights, so it could be small or whatever. So are you trying to say that the incidence or the risk of development of ROP will be smaller in the smaller size twin, and in that way do you counsel your families that way? And have you noticed that? Because when you talk about so in this case what the gestational age is the same. The main criteria that you're using is the birth weight. Okay, both these as per RBSK guidelines are important for development of ROP, but it's not that the birth weight is more important than gestational age or vice versa. So in case of twin pregnancies where the gestational age is the same, can you say or have any of the twin pregnancies concluded that the smaller gestational age infant developed treatable ROP? So that is something you need to look at when you...
Ma'am, we have looked into that also. We have seen twins in these studies. And in most of the twins, they were comparable size and both were small for gestational age. And
True, they will be small for gestational age. But when you are looking at the comparison, so you mean to say that both twins were a similar birth weight?
both were small, matlab less than 10th centile.
Agreed. But there will be one larger twin baby as
Yes,
compared
yes.
to one smaller baby.
Yes.
So have you looked at the smaller birth weight baby developing more incidence of ROP, which is leading up to treatment? That is what is going to, what you're going to extrapolate from your study, isn't it?
We have seen those in most of the twins pregnancy, both of the infants were equally affected. Yes.